Hi, my name is Arush Shah, and my partners are Saif, Abhilash, Sidhu, and Abhiram. So, in this project, we will be looking at both Egypt and DRC, or the Congo, to better analyze which country is best fit for foreign aid from the United States. We will be framing this analysis through analyzing the 8 main Millennium Goals and addressing the United Nations defined targets of each goal. We will address the current situation and ongoing forward/backward progress being made in this country, and then draw conclusions from synthesizing all this information. So let's get started. So let's dive into each of the Millennium Goals.
MG1, extreme poverty and hunger. So Egypt has made significant progress in reducing extreme poverty and hunger in recent years. According to the World Bank, the poverty rate in Egypt fell from 27.8% in 2015 to 6.2% in 2020. So the prevalence of undernourishment in Egypt also decreased from 14.7% to 6.2%. Egypt has social protection programs that also help the poor and have experienced strong economic growth in recent years, which has contributed to poverty rates. On the other hand, the DRC has regressed in terms of poverty and hunger because the poverty rate in the DRC increased from 71% to 73% from 2018 to 2019. And the prevalence of undernourishment in the DRC also increased from 22.9% in 2000 to 69.3% in 2017. This is mainly due to the conflict and instability that plagues the DRC. While Egypt has heavily improved their poverty and hunger rates, the DRC has actually regressed with their poverty and hunger rates.
Millennium Goal number 2 is universal primary education. Both Egypt and the DRC have been working towards this goal. However, both of them are working towards it in different ways and to different amounts of success. In Egypt, the public schools are free and required for all students ages 4 through 14. However, the private schools still cost money, and there's been an effort to privatize education in order to increase the accountability that is found in schools. According to the Human Rights Measurement Initiative, Egypt is achieving 89.3% of the amount of education they could achieve at their current economy size. They've achieved a 92% literacy rate of students within the youth age, and 99% of students who enter primary school stick through it until the end of primary school. In the DRC, each school is free for students within the appropriate age range. However, only 45% of those students who enter primary school stick through it to the end. This is in part due to the danger that comes with going to school, as it's an easy target for kidnappers to kidnap students for either slaves or general rebellion against the government. These schools aren't even always in the control of the government, instead some other ideology group. Despite all of this, DRC has achieved an 82% literacy rate among their youth, and access to school can oftentimes be limited in more rural areas compared to urban areas. On this graph, we can see a neoclassical model of what happens when an education economy increases. We can see the long-run aggregate supply increases without moving the short-run aggregate supply. This is because the quality of the labor increases. However, because this labor group is still in school, they are not contributing positively towards the economy. Millennium Goal number 3 is gender equality and women empowerment. And this is often measured through a measure called GPI, which stands for Gender Parity Index, in which numbers less than 1 represented being in men's favor, numbers greater than 1 being in women's favor, and 1 being exact gender equality. As you can see, Egypt has 0.99 literacy GPI, which means they are doing a very good job in this regard. In terms of school enrollment, it's broken down to primary, secondary, and tertiary. Primary GPI is 1.01, secondary is 0.99, tertiary is 1.04. So you can see they're doing a very good job in that regard also. In terms of land rights, they're almost perfectly equal in that women can inherit and own land. However, passing down land is typically done to the male in order to try and keep land within the party. However, in terms of legal status, there's some issues, such as women, despite being the victim of rape, sometimes hold partial or even full blame due to putting themselves in a position to be raped. The DRC has a 0.93 GPI for literacy, so they're doing pretty good in that regard. However, in terms of school enrollment, they have 0.95 for primary, 0.64 for secondary, and 0.6 for tertiary. We see a steep decline after primary due to the cultural views on gender, which are the traditional gender views that the man is a protector and the woman is a caretaker. Therefore, women often don't complete their schooling careers and instead just get married. In terms of land rights, women are not allowed to inherit land, and they are technically allowed to own land. However, legal disputes regarding land have to be authorized by a man. This Keynesian model shows the effects of improving gender equality on an economy. We see the aggregate supply increase due to the increased amount of labor in the workforce, and aggregate demand also increases due to women being able to purchase more items, resulting in a complete increase in the economy.
Millennium Goal number 4, child mortality. For Egypt, the child mortality rates have reduced from 86 deaths per 1,000 live births in 1990 to 23 deaths per 1,000 live births in 2015. This is a 73% decrease from 1990 to 2015, which exceeds the goal of the 2/3% decrease. One of the key strategies that Egypt has employed in increasing its access to healthcare services for mothers and children. The country has expanded its healthcare infrastructure by building new hospitals and clinics and increasing the number of healthcare workers. Egypt will also prioritize the prevention of and treatment of diseases that contribute to the under 5 mortality. For the DRC, child mortality rates have reduced from 186 deaths per 1,000 live births in 1990 to 97 deaths per 1,000 live births in 2015. This is a 48% decrease from 1990 to 2015, which doesn't quite meet the goal of a 2/3% decrease. The DRC has made efforts to reduce the under 5 mortality rates by expanding its healthcare and infrastructure and increasing funding for health services and prioritizing the prevention and treatment of diseases. The country has also addressed social and economic factors that contribute to the under 5 mortality, such as improving nutrition and promoting gender equality. Despite these efforts, the DRC still faces significant challenges, including ongoing conflict and instability, limiting funding and resources, and one of the highest under 5 mortality rates in the world. Millennium Goal number 5, maternal health. Maternal mortality ratio in Egypt has decreased from 106 deaths per 100,000 live births to 33 deaths. This is a 69% decrease, which is very close to the goal of a 3/4 decrease. Egypt has taken several measures to reduce maternal mortality rates from 1990 to 2015. The government launched the National Safe Motherhood Program, which improved access to quality maternal health care services through training, emergency care centers, and medical equipment distribution. The policy of free maternal health care services introduced in 2008 also improved access to prenatal, delivery, and postpartum care. Additionally, Egypt has invested in educating and empowering women and girls to reduce poverty and increase women's decision-making power, resulting in better health outcomes for mothers and children. The DRC the maternal mortality ratio for the DRC has decreased from 879 deaths per 100,000 live births to 693 deaths. This is a 21% decrease, which is not close to the goal of a 3/4 decrease. The DRC has taken various steps to improve maternal health and reduce maternal mortality ratio between 1990 and 2015. These include implementing policies and programs, collaborating with international organizations, and increasing funding for maternal health, and conducting awareness campaigns. Despite these efforts, the DRC still has a high maternal mortality rate and needs to continue addressing this issue.
MG6, disease. So heart disease causes 21% of deaths in Egypt, and rabies and malaria are endemic in some parts of Egypt. Tuberculosis is also a significant health concern, and Egypt has one of the highest rates of hepatitis C and respiratory infections. And they also have trouble with obesity and diabetes. They've improved the situation with expanded vaccination programs, sanitation, healthcare access, and more. On the other hand, the DRC has had health issues with malaria, HIV, cholera, Ebola, measles, and monkeypox, and they face recurrent epidemics, and they have a weak health system, lack of basic infrastructure and social services, which makes that problem worse. They have a high disease burden, and infectious diseases account for about 65% of all deaths in the country, and there's limited access to safe water and sanitation. So waterborne diseases like cholera and typhoid spread easily. Only 50% of children received all recommended vaccinations, and the DRC has improved somewhat with fighting endemics and increasing immunization, but there's a lack of resources and conflict which will constrain the progress. Overall, the DRC has had more trouble improving disease rates than Egypt.
Millennium Goal number 7, environmental sustainability. There are 3 targets that need to be addressed for this Millennium Goal. The first target is to integrate sustainable development plans into the country's policies and reversing the loss of natural resources. Over the past 2 decades, Egypt has made significant strides in this first target because it has mitigated climate change by doubling its wind energy production. Furthermore, in order to deal with the rising water stress, the country has also explored adaptation activities such as building desalination plants and infrastructure for flood control. It was also the first government in the Middle East and North Africa to issue green bonds, allocating $750 million towards sustainable water management and clean public transportation. The DRC, however, is a completely different case, since no significant strides have been made to integrate sustainable development into their policies. This is because overall DRC reported a weak improvement in national access to water and degradation of sanitation. This weak development is due to a decline in public resources devoted to water and sanitation. And since the public resources designed for water and sanitation have decreased, it can be inferred that DRC hasn't really moved in the direction of sustainable development. Furthermore, any strides towards sustainable development in the DRC was made by NGOs like UNICEF. The second target to address is to halve the number of people with sustainable access to water and sanitation. The third target is to achieve improvement in the lives of 100 million slum dwellers. To evaluate these, we looked at the number of people in both Egypt and Congo with access to water and sanitation, and the percentage of people in slums who have been affected by changes made to water and sanitation systems. In Egypt, water infrastructure coverage has grown substantially over the last decades. In 2014, around 91% of the Egyptian population received water directly into their residence. However, while access to water is almost universal and reliable in urban areas, a significant number of households are still not connected with the water system in rural areas and in urban slums. 7.3 million people are deprived of access to safe water, among which 5.8 million live in rural areas and 1.5 million live in urban areas. In rural areas, around 12% of the population live in dwellings not connected to the water system, while in urban areas, it's 4% which do not have water connections. In DRC, 33 million people in rural areas still lack access to quality water. Despite sustained efforts, only 52% of the population has access to an improved water source and 29% has improved sanitation facilities. However, only 34% of the population in rural areas have access to an improved water source. This is because water sources are not free in the DRC, and thus many rural people can't buy safe drinking water for themselves, and thus a disparity occurs between urban and rural dwellers. Furthermore, it has been reported that solutions to sanitation issues are urgently needed, as access to sanitation has been stagnant for years, with percentages falling from 29.5 in 2017 to 22 in 2018. They also note that open defecation is still practiced by 12% of the households and at least 1/3 of the poorest households. Environmental sustainability in Egypt. In Egypt, 8.4 million people are deprived of access to improved sanitation, mostly in rural areas. Overall, 10% of the Egyptian population did not benefit from access to improved sanitation, with marked geographical and socioeconomic disparities in 2014. In rural areas, on average, the share of population without access to adequate sanitation was around 15% in 2014, compared with around 1% among urban dwellers. From the information present in the slides above, it can be concluded that both of these countries haven't achieved the goal of environmental sustainability yet. Even though Egypt did achieve the first target by trying to integrate sustainable development into their policies, they haven't really made any significant strides towards improving water sanitation and sanitation in their country. Furthermore, the DRC has made no visible strides in achieving any of the targets mentioned by this goal. Thus, Egypt is significantly more closer to achieving the goal of environmental sustainability than the DRC. This can be a significant point when talking about who to give aid to, as Egypt will be more beneficial in terms of environmental sustainability. Furthermore, since the government started issuing green bonds in Egypt, it can be inferred that the government in Egypt is trying to promote environmental sustainability.
Millennium Goal 8, Global Partnership for Economic Development. The first target in this goal is to develop further an open, rule-based, predictable, and non-discriminatory trading and financial system. So, Egypt has worked to better their relations with foreign nations quite well since their military coup in 2013. The United States Department of State shares a very positive outlook on Egypt's interaction with the US, and even says that Egypt is actually the United States' largest exporter in Africa. Now, whether these relations stand with other countries should be analyzed to cross-check whether Egypt is truly open and non-discriminatory in their trading system. If we look at this image above, we can see that the United States takes up only 7.2% of Egypt's exports. In fact, no country has a majority share. Through looking at this, we can say that Egypt is fairly non-discriminatory in their trading policies with other countries. Now, DRC, on the other hand, is quite discriminatory with their trading policies. In the recent years, DRC has started to receive a lot of foreign aid from China and is somewhat sacrificing its relations with other countries to be partial towards China and her goals. In fact, if we look at this graph above, we can see that China's share of DRC's exports is almost 30%, only to be followed by South Africa at 26%. By looking at this image, we can confidently understand that DRC is actually very discriminatory in their relations and does not fully meet the first target of the Global Partnership for Economic Development Millennium Goal. Obviously, looking at the trade policies is only one example of maintaining a fair global partnership for economic development and does not tell us the story, but this is a great in explaining the great impact that China plays on DRC's foreign policy. So let's transition to the second and third targets under this Millennium Goal, which is addressing the special needs of least developed countries and helping landlocked countries. So for this case, both of these countries are not fully capable themselves to provide foreign aid to other countries, obviously, and do not provide much assistance to any landlocked country as they are simply not capable to. However, let's now examine this from the receiver's end. It becomes important to talk about foreign aid received for both of these countries, especially for this target. Egypt currently receives about $8 billion in aid from other countries, while the Democratic Republic of Congo receives on average of $3 billion. This is a great argument supporting providing aid for the Democratic Republic of Congo, as it already does not get enough financial aid as Egypt, but there is a caveat. While much of Egypt's financial aid is dispersed across Western nations such as United States, Great Britain, and others, much of DRC's financial aid comes from China. This piece of evidence alone does not prove anything regarding overall financial assistance, both for each country, but it is important to keep in mind that DRC will be a bit polarized towards China as it is its main investor. The next target is sustainable debt management for both countries. The Central Bank of Egypt revealed on October of last year that the volume of external debt owed by Egypt decreased to $155.7 billion by the end of June of 2022, compared to $157.8 billion at the end of March, a decrease of about $2 billion. The Egypt's economy is slowly growing, and Egypt is doing a great job managing its debt. Even though the economy is still approximately $155 billion in debt, Egypt is showing great signs that it can sustainably manage its debt, which is a great indicator for a country looking to receive foreign aid. On the other hand, DRC is continually seeking to increase its debt rather than trying to reduce it. In fact, recently Chinese entities have extended 53 loans to the Democratic Republic of Congo between 2000 and 2018, amounting to a total of $2.4 billion. Most of this lending was focused on power, transport, and mining sectors. There is a noticeable pattern here with DRC's interaction with China. Furthermore, poor debt management is not a good indicator for a country trying to receive financial aid. So let's further examine Egypt's workforce. Egypt has a labor productivity of 78.87%. This statistic has actually gone up a lot in the recent years, after the country is slowly starting to recover from the military coup. The DRC, on the other hand, is seeing a decline in their labor productivity. Right now, the productivity rate is at 65.67%, and this number is constantly declining due to increased local conflicts and instability. Next, let's look at the pharmaceutical industries in both of these countries, which addresses Target 17 under the Millennium Goals. DRC is very lacking in its pharma industry and barely has any local pharmacies. As we can see, it only has 30 domestic pharmacies for its entire population of 90 million. This makes the process of obtaining the necessary drugs very difficult for the general public and can just be an obstacle to solve for developing your economy. Egypt, on the other hand, has 120, and most of these operate in larger chains throughout the country. In contrast, DRC citizens of Egypt have a lot more access to necessary drugs. The information and communications technology sector in Egypt is very robust, with a growth rate higher than Egypt's overall level of GDP growth, equivalent to 16% in fiscal year 2020-2021 compared to 15.2% in the year 2019-2020. Its contribution to the GDP has increased to 5% in fiscal year 2020-2021 compared to 4.4% in 2019-2020. Total investments in this sector in the year 2020-2021 have reached almost $3 billion. The telecommunications industry has not yet reached all potential consumers and has room to grow. Mobile telephones have a total of 44% penetration rate. Internet penetration is approximately 3% of the total population. And DRC has not yet reached 5G and is still developing its 3G and 4G network.
This is the current state of infrastructure for both countries. The DRC has significant infrastructure challenges due to its extensive forests, low population density, and the crisscrossing rivers, as well as conflicts that have damaged existing infrastructure. The road and rail networks are damaged, and the port infrastructure is poor, with no direct calls from conventional cargo liners and reliance on transshipments from Point Nord in the Republic of Congo. There are several infrastructure priorities that the Democratic Republic of Congo should focus on to promote economic development and improve the quality of life for its citizens. These priorities include road and transport infrastructure, energy infrastructure, water infrastructure, and telecommunications infrastructure. For Egypt, despite notable improvements in the quality of life and quality of its trade and transport infrastructure, Egypt continues to struggle with significant infrastructure deficiencies. These include a lack of multimodal transport options, an excessive dependence on road networks, an inadequately reformed rail sector, and a fragmented court system. There are also several priorities that Egypt should focus on to promote economic development and improve the quality of life for its citizens. These priorities include multimodal transport infrastructure, road sector reform, energy infrastructure, water infrastructure, and digital infrastructure.
We believe that Egypt is likely to undergo more economic growth than the DRC for a number of reasons. Egypt is a large exporter of crude oil and crude oil products. Oil is a product with low elasticity of demand, and Egypt is in several trade organizations, such as the Common Market for East and South Africa. The DRC foreign trade policies are very limited. Even though they're receiving a lot of foreign aid, their limited trade relations puts a maximum on the amount of growth they can achieve on their own merits. Because women are more educated in Egypt than they are in the DRC, the quality of their labor, and thus the quality of the resources, is greater, allowing for higher levels of productivity. DRC cultural values on women limit the amount of education they have due to women preferring to get married as opposed to going to school, thus decreasing the potential and actual outputs due to lower quality resources. This educated human capital in Egypt will continue to increase with Egypt's efforts to increase education. Though the DRC is also making efforts to improve education, there is little evidence of improvement. Egypt's dwindling population of people in poverty will help the growth of the economy because as people leave poverty, they will contribute more towards aggregate supply and aggregate demand. Meanwhile, in the DRC, people are falling into poverty, increasing the amount of people who are not contributing towards aggregate supply and aggregate demand in significant amounts, shrinking the economy. The same concept can apply to the preservation of human life. Both countries are making significant progress in child mortality, but only Egypt is meeting the 2/3 reduction goal. And while both countries are making significant progress in saving mothers during childbirth, only Egypt is close to reaching the 3/4 reduction goal. Both countries suffer a lot from death to disease. However, the death to disease in DRC is over 3 times the amount as in Egypt. Because of the slower growth in the DRC population, the economy will be slowed in its growth. As we can see in the neoclassical model representing the DRC economy, LRIS is right where the SRIS intersects the aggregate demand, showing that they are already at their production possibility maximum, and the lack of a second LRIS shows the lack of improvement in their quality of resources. Meanwhile, in the neoclassical model representing Egypt, we can see the LRIS move from LRIS-1 thanks to their investment in their capital through ways such as education, increasing the real GDP as shown by the jump from Y to Y1.
So ultimately, we chose Egypt as a country that the United States should provide foreign aid to. We made this decision due to a multiple of reasons synthesized from the analysis provided in the previous slides. To begin with, Egypt has a better financial management system in their country. For example, as discussed in Millennium Goal 8, Egypt is managing their national debt really well. Egypt actually slashed their debt by a large amount in the recent years. On the other hand, DRC's corruption has led to its increase in its national debt over the last few years and takes more loans from China to operate. Having a solid, non-corrupt financial system is one of the key components that we should analyze when considering which country the United States should provide foreign aid to. Furthermore, Egypt has more potential for stable economic growth. As mentioned many times earlier, Egypt has a more stable government and economy when compared with DRC right now. A lot of regional and ethnic conflict that is happening in DRC, and especially eastern DRC right now, is hindering its political stability and economic growth. This is also one of the causes for the lower labor productivity in the DRC by almost 13 percentage points according to the Census and Economic Information Center. Analyzing labor productivity becomes crucial when considering a potential country to give foreign aid to because it really lays the foundation for the economy and sets a threshold for how much this economy could really grow. A country with a lower labor productivity would not be a good investment to make for the United States. When analyzing labor productivity, it becomes important to consider other factors to the labor market as well. A more fit labor market allows for high return on investment for the United States as it sets the production possibilities for the country. In terms of health and wellness, Egypt is far surpassing the DRC. 33% of DRC's population does not have access to a secure water source, and although this statistic is slowly rising, it is not doing so at a fast enough rate to happen in a reasonable amount of time. In contrast, Egypt has 91% secured water access rate. This same goes to say about access to better sanitation. In Egypt, only 9% of their population lacks improved sanitation, while in DRC, this statistics reaches a staggering 71%. When these and other various health statistics are collectively synthesized, it becomes obvious that Egypt has much better standards in terms of health and sanitation. Egypt also has better access to education than the DRC. Egypt has a 92% literacy rate and a staggering 99% persistence in continuing primary education. Primary education is free, and the Egyptian government is making efforts to make this available universally across Egypt. DRC, in contrast, has an 82% literacy rate and a 45% persistence in continuing primary education, which is a bit lacking. Furthermore, many parents consider sending their kids to school as dangerous due to increased rape, violence prevalent in those areas. Access to school is limited in DRC, and even though the government is promising to increase this, the government's focus is largely distracted by ethnic conflicts happening in the area. Egypt also has higher access and use of internet and communication technologies, as mentioned before. This is a key factor in the economic growth of both the DRC and Egypt, as access to more technologies can help increase the long-term potential output for the country. The DRC is lacking in this case as well. All of these reasons make Egypt a great country for investment. So where would we focus the aid in Egypt? So now let's discuss this question. And what our group decided on was to focus it on infrastructure. Egypt's current infrastructure is good, but it is not on par with other developed nations. Enhancing Egypt's infrastructure will help add fuel to the fire of Egypt's labor force as well. As discussed before, Egypt already has a highly productive labor force with moderately good access to communication networks. Bettering their infrastructure can radically increase their long-term production output as well. As shown in the neoclassical model here, we can see that an increase in infrastructure will result in an increase in long-term aggregate supply, which shift the whole graph to the right. This shift, as seen above, would result in an increase in the real GDP as shown. Egypt right now is a powerhouse in producing oil and petroleum. Better transportation networks can radically help Egypt speed up their oil production process and get it out to the world faster in order to meet the continual high demand that the oil has around the world. With better infrastructure, Egypt has potential to be one of the most competitive oil sellers in the world, and the United States would get a great return on their investment. Another great aspect of foreign aid and infrastructure is if the United States agrees to carry out these infrastructure projects. This would mean more revenue for United States construction companies and more jobs created for United States citizens, which would result in an increase in the US real GDP.
So the third analysis question was pick one area that each country needs to focus on the most in order to have economic growth and development, and why did you pick that area? So the area DRC needs to focus on the most would be education, how it can improve its education system. This is because there are several problems related to education in the DRC, like many children getting kidnapped to be used as slaves or many children dropping out of school before even completing primary school. Furthermore, another issue includes limited access to schools, especially in rural areas. We think that the DRC should focus specifically on improving their primary education system because past examples of developing economies have shown that when primary education levels in a country increases, the overall quality and quantity of human capital in that country increases too. As the skills of the population of the DRC increase as a whole, it will lead to economic growth and development. Furthermore, the DRC has already made education for the first 6 years free, and thus we believe that the DRC is capable to improve their primary education system without foreign aid as well, because it has already made efforts in improving their education system. On the other hand, Egypt needs to focus on improving their tax system as there are several problems to it which limits government revenue and the overall growth of the economy. These problems include several businesses operating in the informal sector of the economy and thus not being subject to income taxes or any kind of taxes. Some other problems include issues with corruption and bureaucratic inefficiency. We think that Egypt should focus on reforming their tax system as the current one limits the amount of government revenue Egypt's government gets and thus limits government spending. Since the government gets lesser amounts of money than it should be getting from taxes, it can't spend more money towards things like education, healthcare, and other merit goods, which grow the economy. Thus, if Egypt improves their tax collection system, the government will spend more money on education and healthcare, which will grow the economy. Okay, so these are our links, and thanks for watching our presentation.